Well, hey everybody, it's Sandy, and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. Yeah, I decided I'm going to say the slogan every now and then. So today I was asked to talk about the issue of reopening schools, and I have a little bit of trepidation about talking about this subject because, I'm certainly no public health policy expert or anything, and I was wondering if I can bring anything to the table. And I had said in my last video that I think it needs to be like more of a discussion. So I'm just as interested in hearing what you guys are doing and what your thoughts are, as much as you're interested in mine, I guess. So yeah, so I decided I would delve into it, and I've got a few different things here to share with you in the way of some resources I found. But um, I really wasn't sure where to start and where to organize this. And so I'm going to start with something that sounds a little bit scary to some of you. So please don't be too scared by it. It's just, I'm going to link this article below. It's an article that I saw in the New York Times. And it basically is talking about what happened in Israel. You guys might or might not know that Israel was one of the countries that got COVID under control, like bam, like that. They closed their borders. They just did everything right, and they were touted as having really gotten this thing under control. Just they smacked it down. But unfortunately, then they had a resurgence, and they started to have a lot of trouble with COVID after they reopened. And some of this, at least, was from the schools. And so there was an article in the New York Times not too long ago about, here's what happened in schools. Israel reopened its schools and it didn't go so well. Now, some critics of this article say that, look, schools weren't the only things that opened too quickly. Lots of things opened too quickly there. And it's just a lesson. It should teach us a lesson about doing things slowly and deliberately and not just closing, opening. So my reason for bringing this up isn't to scare people who are getting ready to send their kids to school, but it's a way of having it'll allow you to sort of have a conversation, be it with your local, schools or other parents, and try to measure whether things are being done in a gradual and conservative, measured way. There are some startling statistics in this article about how, like, the minute they opened schools, there was like a huge outbreak in one of the high schools. It was like within days, and it became one of the largest school outbreaks maybe in the world. And a professor at the Weizmann Institute in Israel who serves on the task force for the pandemic and advises the government on educational policy is quoted in this article as saying that their reopening of schools was a very big mistake. And they're real open about it, which is nice because it'll allow other countries to learn from it. Now, by a big mistake, he didn't mean it was a mistake to reopen. He meant that the way they reopened was a mistake. He also says in the same article that they can't keep schools closed for a year. They can't have children out of school until they get a vaccine. It's just not feasible. But, this COVID spreads very quickly. And if you have, one or two people have it one day and then it grows exponentially, you guys already know this. So schools can serve as a vector. Now, some people say that little children don't tend to serve as vectors so much as older children. And from everything I've read, that's not really been put to bed, but it's largely widely accepted as true. It seems to make sense to me from what I've seen. Like the outbreaks tend to be more in like middle schools and high schools, at least the ones that are quoted in this article and what I could find. So it seems that the little kid issue is not quite as concerning as the older kid issue, but in schools with little kids, there are still adults, right? There are teachers and staff, and I suppose, that has to all be sort of taken into account. So I was trying to figure out like what I could do to add something to this conversation, if anything. And I did find some things on the CDC's website. And, I found things like some guidelines for considerations for school openings. And basically they have guiding principles where they divide the risk into like three categories. The lowest risk being like all virtual learning and there's no contact. The highest risk being like normal schedule, everything goes back to the way it was before the pandemic. And then the middle is that pretty huge area in between, right? So where you modify the environment, you might modify the class sizes, you might modify the scheduling and things like that. And then they have like, it's a several page document that goes on to talk about the kinds of things that the considerations that schools will have to have. So considering like hand hygiene and respiratory etiquette, face coverings, supplies, things like, our students going to have to share supplies, food service, all these things, maintaining healthy operations, shared objects, ventilation, water systems, physical barriers, time, like leave, time off. Recognizing signs and symptoms for if somebody gets sick in school, preparing for when somebody gets sick and having policies in place. I'm going to put this down below. Now, this is aimed at schools and, school administrators, but I think would be helpful maybe because if parents are investigating, in this process of making a decision, you've got to make a decision about whether to send your own kids, back to school. That might serve as a good guideline for the discussion that you might want to have with people in your schools or your school board or, whoever it might be. I also found something that was sort of similar to it, but it was in the form of a checklist for schools. So for each category, they will have at the top, like, who's the point person for this? And then, the point person for under facilities and supplies, for example. The name will get filled in, and then obtaining supplies. And then it's got every single supply you can think of listed under there. So soap, hand sanitizers that are at least 60% alcohol, disinfection supplies, cloth coverings as feasible. Develop a schedule for cleaning. So and that's just for like one little category. So same thing, it can further guide that discussion because it turns the first article that I just referred to into a checklist aimed at schools, but for schools and districts to use so that they have these procedures in place. And I think that if they're using something like this, the nice thing about it is I think that it can give parents some comfort that there's actually some education going on, right? Because if you're going to, take all the trouble and have this very detailed checklist, probably going to have very refined procedures and some education going on as to how these things get done. So I'm going to link that below in the description box. And then finally, I found a tool that's aimed at parents, and this is called a back-to-school decision-making tool. So I don't know, some parents I know have more choice about it than others. Some parents have private school, some parents can homeschool, some parents have the choice between virtual, some public school districts are offering the choice that you can have your child learn virtually at home or, come to school. But I kind of normally don't like these kinds of checklists because I think they kind of like repackage the obvious. I don't really find that they're all that helpful. But when I got to reading this one, I really think that, I was looking back at when my kids were young because I have two kids, but I actually have two adults. They're not little kids anymore. And I realized actually in planning to talk about this that I've been blissfully, I've escaped having to have this, this problem and walk the floors over this decision because my kids are older now. But looking back, I think that this checklist would have been really helpful for me when my kids were young. And it's basically organized with a bunch of statements, and you either check off doesn't apply or agree, unsure, or disagree. And it's things like, I feel comfortable with my school's reopening plans for reducing the risk. I believe my school has the resources needed to implement a reopening plan. I'm skipping around here. My child can wear a face covering for an extended period of time. My child has a reliable mode of transportation. I'm comfortable with the transportation to and from school. Then I'm comfortable that it's reducing the spread. I'm able to work while my child's not in school. I can successfully do my job, or I'm able to telework. I have access to reliable internet. I can supervise or identify somebody else who can supervise my child during periods of home learning. My child will be sufficiently engaged with home learning. If your child has an IEP, which is an individualized education plan, or some other things, there's other questions to ask yourself. And I just felt like this would help for people, like it would have helped me, I think, to just clarify my own feelings and look at what things weighed more heavily than others, because there's just so many facets about this to discuss and to, worry about that, it's kind of helpful to see like which issues are more weighty, I guess, is what I think this would have really helped me with. It would have helped me clarify what direction I needed to go. I'm certainly not in a position to tell people what to do. Like I said, I've been blissfully, I've escaped this discussion because my kids are older. They're not unaffected by the pandemic. But I did come up with one thing that I had heard. It wasn't my own idea, but there are some hybrids to, home learning versus school learning. And, some some people don't have, they have the option to do a lot of this, but they might not really be able to commit to like a home learning environment. So for example, I worked part-time while my kids were growing up, but my work, of course, is not the kind of work I could have done at home. You can't give anesthesia at home legally. But, you know, the nice thing was my work started very early in the morning. I've always done like ambulatory stuff since I started my own business, which was 20 something years ago. Ambulatory work in surgeon-owned single specialty surgery centers and things like that. So no nights, no call, no weekend, not like hospitals. And I was usually done by the afternoon. So I had some flexibility there, but everybody's situation is different. So I'm not sure how I would have handled this at the time, and it probably would have been different for each kid because I have two kids who are both very different people and they had very different learning styles and different temperaments. But I heard about a family in my area who is doing this thing with a few other families where they have, they're all kind of in a bubble. Okay, they're all four of them are families where they're not really interacting with people outside. You know, they're wearing masks, they're just limiting exposure. I don't know exactly how isolated they are, but it's enough that they feel that they can be with each other. These four families are doing things the same, and they're isolated enough that they feel that they can be with each other, and they're sort of forming a homeschooling network because like maybe one parent was like me is available some afternoons but not every afternoon, or another parent, you know, who knows what, they have all different schedules and they might have all different strengths and weaknesses, but they can help each other this way. And somebody's always going to be around to supervise the kids, and other people they'll be taking turns at things, and some will be going to work. And I don't know, I just thought that sounded like a really interesting idea because sometimes you think, well, these are the only 2 or 3 options, and it turns out there's more solutions to the problem than you thought. I don't know. I will link some of these tools below, and I hope that, I mean, I'm wondering if maybe you've already seen them, but maybe they'll be helpful. For me personally, I would have a certain minimum standard. Masks would be obligatory. Ventilation, I don't care how hot it is, I would want the windows open, even if it means the AC bills are going to be high if it's hot early on in the school year. But I think the ventilation, ideally a fan sitting near the window with facing into the room, so it sucks the air from outside into the room and recirculates it. Between that and face coverings, you can get a really good part of the way there. I think if your kid will wear a face shield, that would even be better because it incorporates the eye protection and more respiratory droplet protection. It keeps the mask cleaner, so the mask isn't as much of a biohazard. But, you know, at certain ages, you can't get your kids to do stuff like that. But I think if kids all had shields and we had everything open, ventilated, you know, classes that weren't all mixing, I think if this were happening when my kids were younger, I would feel more comfortable with that. And if I didn't have some of those things, like not everybody wearing masks and not good ventilation, I don't think I'd be comfortable with it at all. But that's just me. So let me know what you guys are doing, and let me know what some of the unique circumstances that have come up in your own, you know, kids, you know, schooling, what's presented itself for you to have to think about. And yeah, let me know, and let me know if this is at all helpful. I don't know. I'm worried about it. In the meantime, I've got some good news. I did get a package from Synovia. I think it's those nose clips. I've been waiting for those external nose clips to come for the Synovia mask. So I'm looking forward to trying those out and doing a review on them. So yeah, let me know what else you guys would like. And again, thank you so much. I see I've got some more subscribers. I'm always so happy to see that. I'm so happy the content's doing well, and I'm really thrilled that the channel is doing well. And as always, thank you so much, and be well. Bye-bye.